Thank you. Secretary Becerra, it's really good to see you. My daughter, who welcomed you to her school the other day, sends her greetings when I told her that you'll be coming to testify. I wanted to talk to you about drug pricing. I know that we did an incredible job with the Inflation Reduction Act. It was a historic effort to reform and improve the affordability of healthcare, and many of my constituents and seniors are particularly excited about the fact that there is a law that would also place an out-of-pocket limit on senior drug pricing and require drug companies to provide rebate when they raise their list prices faster than the rate of inflation. Many of them are also excited that you now have the ability to negotiate prescription drug prices. So I wanted to ask you, how are these tools, these new tools that we provided, going to help you do just that, lower the cost for people on Medicaid?
Within the Medicare program, it is working tremendously well. It's going to help us if we can get people to understand what benefits they now have. Some people still don't recognize that they're not obligated to pay more than $35 for their month's supply of insulin. Many people aren't aware that they won't pay a penny anymore for a vaccine for, say, shingles, which can cost between $200 and $300. So one of the things we're really working on is communicating more, reaching people, going to districts of members of Congress so we can work with you to make sure people understand what these new benefits are in the president's new prescription drug law.
Mm-hmm. As you know, the Administration for Child and Families hosted its annual tribal consultation, and they were able to look at policies and priorities. In June, can you talk to us a little bit about this important gathering?
At the Department of Health and Human Services, we do consultation with our tribal partners. We believe that sovereignty is an important pillar of tribal governance, and we work closely with our tribal governments to make sure that we know where they would like to see HHS go, our Indian Health Services. And so we engage in very robust consultation with tribal leadership to make sure that when we are putting out policy, it is with the understanding that Indian country is supportive and on board.
And as you know, approximately 7% of all American Indians and Alaska Natives live in urban and suburban areas. Can you also speak to the importance for the department as they do this consultation, and what are they willing to do in order to communicate with urban Indian communities and organizations?
We consider very important the voice of tribal members who live in urban communities and may not live on tribal land. And we have mechanisms to make sure that their voice is included in all of these consultations, because we want to make sure that when we say Indian country, we include every member of a tribal community, whether or not they live on tribal territory.
As someone who represents the largest Native urban communities, I really do appreciate that. That's important. I wanted to switch gears and talk to you about this report that came out from HHS Inspector General's office about the failures of state of child welfare agencies to properly report missing children to the National Center for Missing and Exploited Children. It was shockingly 76% of the missing children were not being reported in accordance with federal requirements. Of the 69%, 47% of the missing children during the audit period were never reported to NCMEC at all. The IG recommended the Administration for Children and Families work with state agencies to ensure proper compliance. It looks like ACF agreed. Can you give us an update on the agencies and how they're dealing to address this issue?
Thank you for the question, Congresswoman. Yeah, we are trying to move forward in adopting many of the recommendations by the Inspector General. We would like to be able to work as closely as possible with the local agencies that are the enforcers of child welfare laws. We want to make sure that every tool that we have that we can put at their disposal, resources as well, we advise them of. I suspect you'll find that many of these local agencies are very stressed, understaffed. We'll do everything we can, and with your support, we might be able to get the resources and authorities to work closer with these agencies to make sure all children are protected.
And I'll be following up with you on that. Thank you, and I yield back.
ChatGPT said, "What if I told you that 3 out of every 4 missing children in America weren't even being reported to the national database that's supposed to protect them? 76% never made it into the system." That's what Congresswoman Ilhan Omar exposed when she pressed HHS Secretary Xavier Becerra point blank about an Inspector General report revealing how state child welfare agencies failed to report missing kids. While Republicans waste time on political theater and culture wars, Democrats like Ilhan Omar are demanding accountability, real action to protect the most vulnerable, our children. And she didn't stop there. Omar also highlighted how the Inflation Reduction Act is cutting drug costs and capping insulin at $35 a month, proof that Democratic policies are actually improving lives, while the other side screams about socialism. This is what governing with compassion looks like: protecting children, lowering drug costs, and defending tribal communities. It's not about partisanship, it's about priorities.